think one thing that makes me unique as a doc is that I was a patient as well. When I was born, I had a bad heart valve. I ended up having to see doctors quite a bit when I was a kid. When I became an adult is when it finally had to be fixed, and I ended up having to undergo 3 cardiac surgeries to get that done. I kind of know what it's like to be on the other side of the stethoscope when you're lying in a bed, kind of scared, not knowing what's going to be happening. I got through it. I ended up being really healthy afterwards, and I think having had that experience, having gone through that, helps me to relate to patients that also have to undergo big things like that, or small things. It's all big when you're a patient. But I think that makes me a better doc and better able to understand, what's going on. My practice philosophy is to try to keep the patient well. The best way to do that is hopefully just to prevent them from getting sick to begin with. One of the most important things I've learned is that so much of what we do in medicine can be fixed just by changes in lifestyle. Changes in your diet, changes in physical activity. Things like this can really help prevent you from getting that high blood pressure, that diabetes. If I can work with the patient to try to get them to change small things now, we can change big things later on. I've completed a course through Harvard on medical acupuncture for physicians, and I think this adds a really interesting tool that I can use to help patients. Acupuncture is a technique that's been used in China for thousands of years now. Fascinating thing that they found that if you put pressure or a needle in a certain point of the body, you can affect somewhere else in the body. Over time, they've studied that if you do things in certain places, you can affect certain diseases. And so this is something unique that I offer to the practice to give patients a different way to treat things. Potentially if everything else has not been working, this could be something else that we could try. Lately, I've started taking the own advice that I've been offering to patients over the years, and I used to be a couch potato. I started doing exercise, I started changing my diet. I was able to lose 40 pounds. I dropped my cholesterol by 70 points just by doing these things without medication. So that's really sold me on the idea that lifestyle changes can make a big difference for patients. Things I do in my spare time now, I enjoy doing martial arts with my daughter. We study karate together. I do Tai Chi, I do yoga. I do courses at the Y and work in CrossFit, and I'm feeling much better than I've ever felt before. And this is just one thing now that I've done it. I know I can tell my patients if I've done it, you can do it, because it's something that anybody can do. I'm Dr. Kyle Van Dyke, Family Medicine.